and welcome to our telehealth information video. I'm Garvin and this video is on Sjogren's syndrome. So Sjogren's syndrome is a condition that affects parts of the body that produce fluids like tears and saliva. So it usually starts in people aged 40 to 60 and is much more common in women than men. It's a long-term condition that can affect your daily life, but there are treatments to help relieve the symptoms. So symptoms of Sjogren's syndrome are as follows. So dry eyes, a dry mouth, dry skin, tiredness, vaginal dryness, muscle or joint pain, swelling between the jaw and ears, and rashes, especially after being out in the sun. So the causes of Sjogren's syndrome. Sjogren's syndrome is an autoimmune disorder. Your immune system mistakenly attacks your body's own cells and tissues. Scientists aren't certain why some people develop Sjogren's syndrome. Certain genes put people at higher risk of the disorder, but it appears that a triggering mechanism, such as an infection with a particular virus or strain of bacteria, is also necessary. In Sjogren's syndrome, your immune system first targets the glands that make tears and saliva. It can also damage other parts of the body, such as the joints, the thyroid, the kidneys, the liver, your lungs, your skin, and your nerves. So, Sjogren's syndrome is an autoimmune condition that can occur at any age. But again, as I said, is most common in older women. Many patients develop Sjogren's syndrome as a complication of another autoimmune disease, such as rheumatoid arthritis or lupus. Symptoms vary in type and intensity, but many people with Sjogren's are able to live a normal life. Most of the treatment for Sjogren's syndrome is aimed at relieving symptoms of dry eyes and dry mouth and preventing and treating long-term complications such as infection and dental disease. Treatments often do not completely eliminate the symptoms of dryness. So most patients with Sjogren's syndrome remain healthy, but some rare complications have been described, including an increased risk of cancer of the lymph glands, which is lymphoma. Thus, regular medical care and follow-up is important for all patients. The causes of Sjogren's syndrome are: Sjogren's syndrome is caused by the immune system, which is our body's defense against illness and damaging healthy parts of the body. So this is what's known as an autoimmune condition. So the bits of the body usually affected are those that produce fluid, like tears and saliva. But other parts of the body can be affected. It's not clear why the immune system stops working properly. It may be linked to genetics. So some people may be born with genes that make them more likely to get an autoimmune condition. Also could be linked to hormones. The female hormone estrogen may play a part, as the condition is more common in women than in men. Sjogren's syndrome can occur with other autoimmune conditions like rheumatoid arthritis and lupus. So this is known as secondary Sjogren's syndrome. Primary Sjogren's syndrome is where you do not have any other related conditions. So treatments for Sjogren's syndrome. There's currently no cure for Sjogren's syndrome, but there are several treatments that can help, such as eye drops that keep your eyes wet, so they'd be artificial tears. Also sprays, lozenges, and medicated sweets and gels that keep your mouth moist, and medicine that helps your body produce more tears and saliva. Things you can do if you have Sjogren syndrome. So if you have Sjogren's syndrome, there are some things you can do to help relieve your symptoms. So these include avoiding dry, smoky or windy places, avoiding reading, watching TV or looking at screens for a long time, practicing good oral hygiene, avoiding alcohol and no smoking. So lifestyle and home remedies that would help. So many Sjogren syndrome symptoms respond well to self-care measures. To relieve dry eyes, you can use artificial tears or an eye lubricant, or you can actually use both. Your doctor might recommend artificial tears without preservatives. So the preservatives can irritate the eyes of people with dry eye syndrome. Also increase humidity. So increasing the indoor humidity may reduce your exposure to blowing air and can help your eyes and mouth from getting uncomfortably dry. So to help with dry mouth, don't smoke, increase your fluid intake, stimulate saliva flow, so sugarless gum or citrus flavoured hard candies or sweets can boost saliva flow. Try artificial saliva or saliva replacement products often work better than plain water because they contain a lubricant that helps your mouth stay moist longer. These products come as a spray or lozenge. Use nasal saline spray. A saline spray can help moisturize and clear nasal passages so that you can breathe freely through your nose. A dry, stuffy nose can increase your breathing through your mouth. So for oral health, dry mouth increases your risk of dental cavities and tooth loss. To help prevent those types of problems, brush your teeth and floss after every meal. Schedule regular dental appointments at least every 6 months. And use daily topical fluoride treatments and antimicrobial mouthwashes. Other areas of dryness in the body. So if dry skin is a problem, avoid hot water when you bathe and shower. Pat your skin and don't rub it with a towel. And apply moisturizer when your skin is still damp. Use rubber gloves when doing dishes or house cleaning. There are vaginal moisturizers and lubricants which help women who have vaginal dryness. So that brings this video to an end. If you have any questions, you can leave them in the comments below or contact me through the website mytelehealth.info or call into Lynch's Pharmacy in Douglas, Cork. You can ring 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.